My name is Adrienne Moore, and I live in Bloomington, Illinois. I am 47 years old, a wife, and a mom of 3. 5 years ago, right in the middle of the COVID pandemic, I was diagnosed with a rare and incurable blood cancer called multiple myeloma. It's typically found in men in their 70s, but I was only 42. But my story started long before that. I had been dealing with fatigue, shortness of breath, and back pain for years. I had gone to a chiropractor and I did months of physical therapy and nothing helped. But in October 2020, the pain became unbearable. I went to the ER 2 weeks in a row. The first time they ran an EKG, took some x-rays, did some blood work, and told me that I had a muscle strain. They gave me lidocaine patches and sent me home. They said that if it gets worse to come back. And it did. By that following weekend, I could barely walk. I ended up on our bathroom floor, unable to stand. I asked my husband, Chad, to call 911. By the time the paramedics got there, my blood pressure was extremely high. And instead of going by ambulance, I had Chad drive me, which was a mistake because we waited 9.5 hours in the ER and still they didn't take my pain seriously. The first doctor blamed my pain on my gallbladder and my keto diet. She completely dismissed my back pain. It wasn't until a shift change that a nurse practitioner finally examined me and agreed to a CT scan. After the scan, we waited for about 45 minutes to get the results. He came back in the room and told me that it looked normal and apologized for not knowing what was causing my back pain and sent me home again. But that night, around 11:30, he called me and he said that the scan hadn't been read completely and that I actually did have a spinal fracture and that he needed me to return to the ER immediately. When we arrived, he was waiting in the parking lot with a wheelchair. He rolled me into a room and told us that due to the location and that I hadn't experienced any trauma, the fracture was likely caused by a disease, either leukemia or something I had never heard of, multiple myeloma. Further scans showed the cancer had eaten holes called lytic lesions in my spine, skull, sternum, pelvis, humerus, and femur. My spine was so unstable that I was admitted immediately to the hospital and placed in a back brace. A few days later, I underwent a 7.5-hour corpectomy surgery to stabilize my back with 2 expanding cages, 2 rods, and 8 screws between my thoracic 3 and my thoracic 7. Because it was COVID, Chad was the only visitor that I was allowed to have. So we had to tell our kids over the phone that I had an incurable cancer. We couldn't hug them. We couldn't be there with them. They were left to deal with this news and process this alone. Our youngest daughter was just getting ready to go back to in-person schooling after being remote for so many months. Her first day of in-person junior high and her 12th birthday both happened while I was in the hospital. But thanks to one amazing nurse, I was wheeled out through a basement exit just to see the kids for about 5 minutes in the parking lot, at a distance. But that was the only time that I saw them for those 9 days that I was in the hospital. Multiple myeloma is a blood cancer that attacks plasma cells. It weakens the immune system and destroys bones and organs. But it almost always starts with 2 precancerous stages, MGUS and smoldering myeloma. These conditions can be detected early with blood tests. Even with high protein levels and abnormal labs flagged in red, I was still overlooked. My labs were ignored and my pain was dismissed because I didn't fit the standard profile of a myeloma patient. I was a 42-year-old active white woman. Because of that, my spine broke, and now I live with permanent damage. I can't do things I used to love, like playing tennis or roller skating or horseback riding, jumping, or even running. I miss out on all the activities that I used to enjoy with my family. That day, I wasn't just diagnosed with cancer. I started grieving the life that I used to have. That's why I'm here. That's why I'm advocating. So this never happens to another patient. Here's what people don't realize. The average age at diagnosis for a myeloma patient is 69. Less than 1% of myeloma cases occur in people under 35. And women under 50 make up a very small fraction of that. But early detection can prevent broken bones, organ damage, and trauma like mine. So here's what I'm asking. I'm asking our leaders to act to make sure testing and treatment decisions are based on symptoms and not stereotypes. You can help by advocating for federal grants that support diagnostic education and survivorship care, pushing for funding that helps detect blood cancers earlier, supporting training for providers to recognize atypical cases, improving follow-up systems for labs and scans, expanding access to mental health and support for rare and chronic illnesses, and involving patients like me in policymaking, especially those who don't fit the mold. Because when we wait until bones are broke, it's already too late. No patient should have to lose their health, their mobility, or their peace of mind just to finally be seen. Please help make sure all patients are heard the first time. Thank you.